Kim Finney, the Cardiac Rehabilitation Specialist at Maui Memorial Medical Center, and I'm also on the Board of Directors for the American Heart Association here on Maui.
My name is Jackie Singh, and I'm the Stroke Coordinator at Maui Memorial Medical Center, and I too am on the Board of Directors for the American Heart Association here on Maui. We're here tonight to talk to you about cardiovascular disease and stroke and what you can do to prevent it. Okay, the goals of this program this evening are to help you recognize the seriousness of heart disease and stroke, to learn the warning signs of heart disease and stroke, discuss the steps that you can take for a healthier you, and start with at least one healthy thing that you can do today. Just so you know, one person dies from heart disease every 33 seconds. And what is cardiovascular disease? It's narrowing of the coronary or heart arteries that causes heart disease and angina and can cause a heart attack. Angina is chest pain. Cardiovascular disease is the #1 killer of Americans. Each year, the very first sign of heart disease that people will have may be sudden death. 500,000 Americans die that way. The heart attack warning signs, the most common signs are uncomfortable chest pain, squeezing or tightening or crushing chest pain, pain that may spread to your shoulder, your neck, or your jaw. You can also be lightheaded, have shortness of breath, and feel like you're going to faint. Women, however, tend to have more atypical signs of heart disease. They may have chest pain, but they also may have stomach or abdominal pain. Nausea, dizziness, a feeling of fatigue, shortness of breath, difficulty breathing, or an unexplained anxiety. They also can have palpitations or the feeling that their heart is beating rapidly and break out into a cold sweat and become very pale. A sudden onset of a very severe toothache can also be a heart attack, and most people wouldn't recognize that. The other thing that women may experience is a real feeling of impending doom. So if somebody says they feel like they're going to die, listen to them, because they probably are. How do we diagnose heart disease? Well, your medical history, a physical exam. There are certain diagnostic tests that you can have, like when the doctor takes an EKG of your heart, or an angiogram, or an echocardiogram, which is an ultrasound of your heart. So what do you do if any of these warning signs occur? Well, the first thing that you want to do is call 911. This is an emergency, and if you get to the hospital in time, there are certain things that we can do to prevent that heart attack from continuing. So I want to talk about stroke a little bit now. And stroke is the same risk factors and the same disease process as a heart, except that it's happening in your brain. And another term that can be used for stroke is a brain attack. It occurs when a blood vessel in your brain either gets blocked or it bursts and you have bleeding into the brain, but it's blocking the blood flow to a certain part of your brain. Stroke is the 3rd leading cause of death in the United States, and a stroke occurs about every 53 seconds. It's the leading cause of long-term serious disability, not only in the United States, but in the world. And the cost of stroke is roughly $62.5 billion a year. Part of that is the indirect costs from loss of job and productivity, and the other is direct hospital costs. There are 2 types of stroke: an ischemic stroke, or a stroke caused by a blockage in the blood vessels, or a hemorrhagic stroke, which is bleeding into the brain. Stroke warning signs, and this is where most people miss it. And the key word in the signs I'm going to give you is sudden. A sudden onset of numbness of the face, the arm, or the leg, or all 3, especially on one side of the body. Sudden confusion, sudden trouble speaking or understanding the spoken word. Sudden trouble seeing. Sudden trouble walking, or loss of balance or coordination. Or a sudden severe headache. Most people describe it as the worst headache that they have had in their entire life. Again, the key word here is sudden. If you have some of these symptoms, but they've been happening for weeks or months or days, it's probably not a stroke. What do you do if these warning signs occur? Again, call 911. Stroke is an emergency and every minute counts. Every minute that you wait, you lose brain cells. In the past, there was no treatment for stroke. But in the past 15 years, there is a treatment, but it is very time dependent. So you must get to the emergency room right away, and calling 911 is the best way to do that. Now, what causes stroke and heart attack? Well, there are certain risk factors that people have. Some of the risk factors that you can't change are your age, your family history, your race. There are certain people that have a higher incidence of stroke and heart attack, and that would be African Americans, Native Americans, Hawaiians, and Hispanics. Your sex. Males have more heart attacks and strokes than women. However, women are more likely to die from a stroke. And women have other risk factors that also affect them, such as the using birth control pills, hormone therapy, and even pregnancy. 60,000 more women die from stroke every year than men. And if you've had a prior heart attack or a stroke, that can also increase your risk. High blood pressure is probably the single most important risk factor for stroke. Nearly 1/3 of people who have high blood pressure don't realize they have it, and that's why it's called the silent killer. 50 million Americans aged 60 and older have high blood pressure, and 1 in 3 African Americans have high blood pressure. So what are the high blood pressure risk factors that you can control? Being overweight, eating too much salt, drinking too much alcohol, a lack of physical activity, diabetes, and increased stress. So what I'm going to do now is turn this over to Kim, and she's going to tell you what steps you can take to help control those risk factors and decrease the amount of strokes and heart attacks that occur.
So when we talk about risk factors for heart disease and stroke, it's really important for us to know what we can do something about. And like Jackie mentioned, some of the risk factors are not controllable. And so those things we should be aware of, but at the same time, not concentrate as much on those things and concentrate on the lifestyle activities that we have control over so that we can make positive changes in our life and our health. So with regards to some steps that you can take to make yourself healthier and to live a healthier lifestyle, which is one of the things that I do in my job as a cardiac rehab specialist, is to help people identify their lifestyle patterns and behaviors and what they can do to improve that. So some of the things that we discuss with our clientele and with the public have to do with diet and physical activity and whether they use alcohol or tobacco products. Also managing your stress, that was mentioned before too. So a lot of those things we may not be really aware of on a day-to-day basis, but we need to be more aware of and prioritize for ourselves so that we can be healthier. And so with regards to diet, there are a few things that you can do that are just simple things. For instance, learning how to read a food label, varying your cooking routines so that it's not the same thing all the time, and incorporating new ideas as far as food products and looking for things with less salt and less sugar and less processed foods, more natural foods. And try some traditional recipes with some makeovers. In fact, one of the things that we recommend for people from the American Heart and Stroke Association is a book they put together called A Dash of Aloha, which is a cookbook with local style recipes involved. And it's available at Borders and online, and also at American Heart Association office here on Maui. So I just wanted to mention that because there's all kinds of ways to increase your healthy diet. Also, have your blood pressure checked and get your blood checked regularly. It's really up to you to take charge of your health and listen and work with your healthcare providers in order to just know what your risk is and lowering your risk that way. So knowing your numbers, and some of the numbers you need to know, as I mentioned, your blood pressure, and also your cholesterol numbers, and also your blood glucose levels, We do have a very high incidence of diabetes here in Hawaii, and that is a really major risk factor for heart disease and stroke. And then let me just say, if you do smoke, as your healthcare provider, I would really encourage you to stop smoking, because that is the single most preventable cause of death. And it is a major contributor, not just for heart disease and stroke, but also for many other health issues and disease processes. And if at all possible, avoid secondhand smoke as well. So another thing I wanted to mention is if you are on medications, blood pressure medications, heart medications, diabetes medications, whatever it is that you're on, know what those are, know what the signs and symptoms are of any kind of side effects. And if a medication is not working for you and you feel badly on that medication, talk to your doctor so that there can be adjustments made. Try not to stop your medication without discussing it with your physician, and try to take your medication as it's prescribed. A lot of times people don't like the way they feel on their medication, so they just choose not to take it. And then there's also issues sometimes with just the availability for health care and prescription medications. So there are programs available to help you with that as well. What are some other things that you might be able to do and have access here on Maui? Well, we do have a few programs available that American Heart Association and Stroke Association also works alongside us with. One of the things that I know was mentioned earlier, when you call 911 in the case of an emergency, it's also very helpful for you to know how to do CPR. Certain equipment also available out in the community called an AED, which is an automatic external defibrillator. And those pieces of equipment that are out there in the public are what helps us to be able to actually resuscitate patients, because adults, when they have sudden cardiac death, usually have what we call a lethal dysrhythmia. And it's a abnormal heartbeat that cannot sustain life, and it needs an actual electrical shock in order to stop that irregular heartbeat and allow your heart to possibly come back and beat again on its own. So the two really important factors that we want to make sure people are aware of are being able to do rescue measures like CPR and the use of those external defibrillators out in the community. One of the things that the American Heart Association also has available is a package called Friends and Family CPR Anytime. And it's a package that costs, I believe it's around $30. You can purchase it online, but you can also get it through our office here on Maui at American Heart Association. And it has a mannequin inside, a DVD, and so you can practice doing the CPR activity with the mannequin, and it takes you through those steps so that you're not standing there with a loved one or someone who's having trouble and not able to help them in any way. CPR is very important after 911 is called. Also, we have available some other resources here on Maui. We have a program called Malama Pu'uwai, which the hospital provides to the community 4 times a year. And it's a program that I am involved with. And basically what it is a 6-week cardiovascular health and wellness program. And groups get together in their area of the island. We go all over the island to meet once a week for 6 weeks. And we do screenings, we do education, we provide different forms of exercise, and we provide healthy food. So it's a very wonderful program that's available to anyone who is interested. And the best way to sign up for something like that is to call me at 243-3047. And we, like I said, do have it on all areas of the island. From the west side to the south side, up country, and at the hospital in the central Maui area. A couple other things that I wanted to mention: if you were interested at all in getting involved with the American Heart Association, they have several volunteer opportunities available to the community. And just to mention, any time of the year that you're watching this, but February is Heart Month, Heart Awareness Month. And you might have noticed that Jackie and I were wearing red today. And that's in support of one of the other initiatives called Go Red for Women, which is a subset of the American Heart and Stroke Association that recognizes how devastating heart disease and stroke is to the population of women, not just in the United States, but also worldwide. And so Go Red for Women, if you're interested in being a part of that, we'll be having activities throughout the community all through the year. And so there's many ways that you can get involved and support American Heart and Stroke Association. Also, once a year, we have a big event on a Saturday morning called the American Heart Association Heart Walk, where there's all kinds of health information. People walk in memory of people that they've lost to heart disease or stroke. We have survivors that also walk, and it's a great fundraising opportunity and just an all-around good activity to participate in. So that pretty much ends our programming, and please feel free to contact Jackie or I at the hospital with any questions you might have concerning heart disease or stroke or the Malama Pu'uwai program. And contact the American Heart and Stroke Association with any questions that you might have with their ability to provide educational materials or offerings, and also to provide speakers in your area, or if you have any questions about how to volunteer. Thank you for your time.